So welcome to the today's class. So रथ यात्रा के इस सुनहरा अवसर में आपको सभी को बहुत बहुत बधाई और शुभकामनाएं। इसी के साथ हमें शुरू करने जा रहे हैं आज का टॉपिक, दैट इज लैक्सेटिव्स एंड पर्जेटिव्स। फर्स्ट वी स्टार्ट द प्रोबायोटिक्स। Probiotics. So the probiotics is causes the stool formation. What is the work? What is the mechanism? It is the stool formation by decreasing the intestinal motility. Stool formation. Stool formation by decreasing intestinal mortality. Yeah. What is the mechanism, or what is the mechanism of action, or what is the work of probiotics? The probiotic causes the stool formation. How? By decreasing the intestinal mortality. The probiotic causes the stool formation. Stool formation by decreasing the intestinal mortality. So the probiotics is used to treatment of the constipation. To treat constipation. Yeah, the probiotics is used to treatment of the constipation. To treatment of the constipation. Then the prebiotics. Then the prebiotics. Then the prebiotics. The prebiotics is the methyl cellulose, bran, husk. Clear? The probiotics it is the methyl cellulose, bran, husk. The prebiotics are the methyl cellulose, bran and husk. Bran and husk. What is the work of prebiotics? The prebiotics was to smooth removal of fecal matter. To smooth removal of removal of fecal matter. Then the prebiotics was to smooth removal of fecal matter. To smooth removal of fecal matter. The three are the prebiotics. Then we move to stimulant laxatives. Stimulant laxatives. Stimulant laxatives. Clear? Stimulant laxative is 5-HT4 agonist. It is 5-HT4 agonist. Clear? The stimulant laxatives are the 5-HT4 agonist are the stimulant laxative. So the 5-HT4 laxative is mosapride. The drug is the mosapride. The mosapride is a 5-HT4 agonist and is called the stimulant laxatives and is called the stimulant laxatives. So it is used the mosapride is used the chronic constipation. It is used in chronic constipation. In the chronic constipation, you use the mosapride that is the 5-HT4 agonist. Then another stimulant laxative is bisacodyl sena. Bisacodyl sena is bisacodyl sena. The bisacodyl sena is a stimulant laxative. In the bisacodyl sena, it causes pink, yellow, brown urine. Causes pink, yellow, brown urine. Clear? The bisacodyl the side effect of bisacodyl is the causes pink, yellow, brown urine. That is a stimulant laxative. The bisacodyl is a stimulant laxatives. So we move to the castor oil. The castor oil is used in case of the constipation. Castor oil is used in constipation. Used in constipation. Here, the castor oil is used the constipation. It causes the smooth removal of fecal matter. Smooth removal of fecal matter. Always remember, we do not administer the castor oil at night. Do not administer at night. So castor oil do not administer at night. Always remember. The castor oil always used in constipation. Always used in the constipation. Then we move to saline laxatives. Saline laxatives. Then saline laxatives. The saline laxatives is the strong laxatives is used for the bowel cleaning. It is a strong laxatives. Among all the laxatives, the saline laxative is the strong laxatives. Used for bowel cleaning. The saline laxative is the strong laxatives used for bowel cleaning. Bowel cleaning. Then we move to the polyethylene glycol, that is PEG. Is polyethylene glycol, that is PEG. Yeah, that is the polyethylene glycol. Polyethylene glycol, that is the PEG. The used in IBS. IBS means the irritable bowel syndrome and constipation. Yeah. The polyethylene glycol or the PEG used in IBS, used in irritable bowel syndrome and the constipation. Constipation. So the polyethylene glycol is used in the non-secretory diarrhea. Also used in non-secretory diarrhea. Yeah. The PEG or polyethylene glycol also used in the non-secretory diarrhea. Non-secretory diarrhea. The polyethylene glycol is the loperamide. The drug is loperamide. Loperamide is the polyethylene glycol. The loperamide is the polyethylene glycol that is used in the IBS constipation and the non-secretory diarrhea also. Then the allocetron. The another peg is the allocetron. The polyethylene glycol drug is the allocetron. Most commonly used in diarrhea for females. The allocetron is the polyethylene glycol or the PEG. It is most commonly used in the diarrhea of female patient. Diarrhea of female patient. Then we move to the octreotide. Octreotide is also a PEG. Octreotide, that is the somatostatin analog. Then the octreotide. Octreotide is a somatostatin analog. The octreotide is a somatostatin analog. That group contains the polyethylene glycol. The octreotide in the which group? The octreotide in the PEG group, that is the somatostatin analog. That used in secretory diarrhea and the GIT cancer. The octreotide is used in secretory diarrhea. The octreotide used in secretory diarrhea and the GIT cancer. GIT cancer. Yeah, the octreotide is a somatostatin analog used in the secretory diarrhea and the GIT cancer. Then we move to the traveler's diarrhea. The drug of choice of traveler's diarrhea is the ciprofloxacin. Ciprofloxacin. Traveler's diarrhea. The traveler's diarrhea, DOC means the drug of choice. Drug of choice is the ciprofloxacin. Ciprofloxacin. In the traveler's diarrhea, the drug of choice in the traveler's diarrhea, the drug of choice is the ciprofloxacin. Always remember the ciprofloxacin is the fluoroquinolones group. Fluoroquinolones group. Fluoroquinolone. And the ciprofloxacin is which group? It is the fluoroquinolone group of antibiotics. So this is all about the laxatives and purgatives. So next class we will discuss about a new topic. So thank you to all. Happy Rath Jatra.